orientation is considered. So I'll be sharing a small PPT, and after that, if you have any queries according to the syllabus, we will go through that. Okay. Is my screen is visible?
No, madam.
Now is it visible?
No.
Now is it visible, sir?
No, madam. Yeah, now it's visible.
Yeah. So I'll just good evening, everyone. Myself, Dr. AmruthagoWri. As sir has rightly introduced, I'm currently working as Assistant Professor, Department of Shalya Tantra at RKM Ayurvedic Medical College, Vijayapura. And we are focusing on the topic Shalya Tantra, paper 1. I need you all to relax and listen, because you have already listened to the subjects papers orientation from 13th onwards, from Samhita Siddhanta to Kachikitsa and Prasuti also. I hope you have gathered all the basic information regarding reading and revising, recollecting and reproducing of the syllabus topics. Mainly in today's class, we'll focus on fundamental concepts, that is the paper 1 syllabus, how you have to present and focus about that. Am I audible now, sir?
Yes, madam, it's audible.
And the screen is being shared, right, sir?
Yeah, it's shared.
Okay. So the fundamental concepts and presentation skills, how exactly the Shalya paper is different from other fundamental papers, and techniques for smart study. As I was saying, reading, revising, recollecting, and reproducing. Here we have to focus how you have to study smartly, because now we are in the end moment, because your exam dates have been already announced and hardly you have less than a month period. So you are not having enough time to read now. Whatever you have read, you have to revise and you have to recollect. So make time for recollecting and reproducing, means you have to make sure that you can orally reproduce it, and also while writing you can reproduce it. So we'll go by one. As exam and lengthy papers topic is considered, we know sometimes and many a times the clinical subject papers we feel very lengthy. How much ever we write, the time is not enough. The 3 hours for 100 marks, it's not enough for many of them. Those who know the answer also, they say always it is lengthy paper. So this time management is a key factor in every exam. As per Shalya is considered, we know we have 20 MCQs, 8 short SAQs and 4 LAQs. So based on that, marks per question will be having 1 marks for MCQ each, 5 marks for SAQ and 10 marks for long answers. Here, marks distribution you are all are well aware of. Time management, it is very important you finish your MCQs within 30 minutes. So half an hour is a maximum time for all the MCQs to attempt. If you don't know for any MCQ, you don't know the answer, or you have a duality that among two options, which is the correct answer, then please make it as a pending one and skip to the next attempt or next question. Why? Because time management is very, very important. At the end, when you have that 10 minutes, 15 minutes, at the end of the 3 hours, you can again go back and check the MCQ and you can attempt that, or you can write it down. So you have to finish the 30 minutes or 20 to 30 minutes is a maximum time. So 1 minute per question is the maximum time for MCQ. Short answer questions, you are having 8 questions, that is you have to finish in 2 hours. So you have a allotted page number for each questions. So you can attempt any of the questions, whichever you know the correct exact answers, you can attempt first. So the answer paper booklet, you have to check the each 5 marks question, how many pages have been allotted, question number wise answer paper will be given to you. So you have to answer the stipulated answer for the marked question. See, for example, question number 5 you have, so that will have a 5 marks. So how many pages is allotted for question number 5? So you have to finish that within 10 minutes exactly. So whatever the content is there, you have to finish within that. So extra 5 minutes, revise and recollect within, and you have to write it down. And whatever point is being missed, don't just waste the time thinking the answer for the same question. So you have to move on to the next. That is a very important point. So I'm not here discussing the important topics to study or important things only to study for the exam and skip some points for the exam. Here we are focusing on the smart study, presentation skills, and how to manage the time. If you have a queries at the end of the session, I'll open the syllabus copy and I'll answer along with that what to write, how to write also, if anybody has a queries at the end. So 10 minutes for the each question. Answer the question in the stipulated pages. This is very, very important. During exams, many students write answer for question number 4 in question number 5. So knowingly you are making a mistake. So with the tension or stress, you should not do that. Please keep your mind calm and attempt the questions. 10 to 15 minutes for each question. So you are having a 2 hours for 8 questions. 10 to 15 minutes for each question for LAQ. So here sometimes if you take 10 minutes for 5 marks question, you are having a more time for a LAQ. But many evaluators say how much ever you write, you won't get out of 10 out of 10. So maximum marks 7 to 8 or to the maximum 9 you get. So more focus should be, because you have a 1 marks for MCQ, you have a sure short answer because given option will have the answer. So you can recollect and you can opt for that. And you can have a 15 to 20 minutes for LAQ if you save the time in SAQ and MCQ. That's how you distribute the 3 hours for exams, so it won't be a lengthy paper. And if you move on to the syllabus, this table is exactly from your syllabus copy. No need to take a screenshot. Just I am highlighting with the bold black letters which have only more mentioning of LAQ, and they do have MCQ or SAQ as per the syllabus, but they have LAQ, and other points does not have a LAQ from that syllabus. If you focus, they are mainly the fundamental core principles of Shalya Tantra, parasurgical procedures, Trivida Karma, the Ashtavida Shastra Karmas, Yogya Sutriya, that is simulation, and Yantra Shastras. So you have a surgical instruments. Introduction to Shalya Tantra is a favorite question because even students feel easy to write, to define Shalya, Shalya Tantra, scope, and how it was declined, how it got improved. And recently we have a good news that Royal College of Medicine has published a Sushruta Samhita, and also the idol is being installed there. So it is globally recognition has happening for Sushruta and Sushruta Samhita. So you can quote those things as a introduction part while you write the answer for the syllabus 1. Okay, and Yantra Shastras have a information like a maths. So you have a correct classification, numbers, and the Yantra or Shastra Guna, Karma, Dosha, all these are shlokas are very, very important. See how beautifully marks distribution is being focused. 15 marks, 10 marks, they are the part where LAQ or large questions are being asked, large essay answer questions are being asked. Trivida Karma, where pre-operative, operative, and post-operative question, you can see it can come for 5 marks also, or 10 marks also. How to differentiate? 5 to 10 marks question, how to differentiate? The same answer you cannot write for 5 marks or 10 marks. What is the main point that you have to write? So in Trivida Karma, focus how the way of question, how the question is being asked. So you have to focus more on Ayurvedic aspects where Chedana Prakaras are being told, the counter incision, Pratibhedana information is told, NBM, preoperative aspect, we have a beautiful explanation of importance of NBM. That must be written. Operative, they have given the example of abscess, incision and drainage. The stepwise explanation, which is even true today as a Hilton's method of incision and drainage, which you can write as a part of Trivida Karma question if they asked, and the same procedure is there in Samanya Vyadhi Parichaya in abscess, okay, Vidhradi. And post-operative care, you have Balavarnagni Karya. You have the basic Dalhana Tika for Trivida Karma, which need to be learnt actually. One sentence, one line for each. Purva, Pradhana, Paschat Karma. The beautiful shlokas are there. Langhanadi Virekantam Purva Karma Vranasya cha. Langhanadi Virekantam means that is not exactly explained in Trivida Karma. It is told in Shashti Upakrama of Vrana. Vrana Chikitsa, if you see, you have from Langana to Virechana, whatever modalities are there. We usually call it as a Purva and Pradhana Karma in Panchakarma, which is Purva Karma in Shalya. Operative methods are mainly Ashtavida Shastra Karma, that is Patanam Ropanam Chaiva Pradhanam Karma Tatsmritam. Post-operative care, you have Bala Varna Agni Karyam. Here, Bala of a Rogi and Varna, that is discoloration if the wound is there. So, incision site, you have surgically produced a scar, or the patient has a disease and scar is being produced. That has to be, pigmentation should be neutralized. So, that is Varna Karya. And Agni Karya, Bala, Varna, Agni. Agni is Jataragni and also as well as Bhutagni and Dhatwagni. Those has to be normalized. So Dhatu Samya Kriya is the ultimate aim of Ayurveda we have. So that is to be done by Agni Samanataha. So that Samavastha, not Vishamas Avastha or not Tikshna Avastha or not Manda Avastha, Samagni Avastha should be there in all the levels. So this is Ayurvedic aspects, and we have a beautiful post-operative care of Dhupana Karma, Rakshogna Karma also. Okay, so I am not explaining each syllabus because it will take a longer time. You have to focus on those points when you are writing for a 5 marks. And if you are writing for a 10 marks, you have to and must and should mention the contemporary aspect, correlations, pre-operative history, the pre-anesthetic history, where patient, if it is they are epileptic or diabetic or hypertensive, you have a different selection of anesthesia and equipments and instruments to be kept ready. Operative, you have different stages and steps for different surgeries. You can give any simple surgical example and you can write operative steps. Even IND is okay for in that matter. Okay, you have to be very crisp and precise about the steps you write whenever you are writing a surgical procedure. Okay, that holds good for paper 1 as well as paper 2. Whenever you are writing a surgical step, it has to be very brief, precise and crisp and to the point. Post-operative care, you have to mention not only that you are using analgesic, antibiotic or antiemetic as pre and post, you have to also take care of patient should be informed about post-anesthesia complications or post-operative complications. So those things should be managed. So these contemporary aspect explanation should be equally present for 10 marks question if Trivida Karma is asked, or even that matter of if you say as a Rakta Srava and Rakta Stambhana Upaya if asked, then you have to mention those things. Okay, so Shatkriya Kala in surgical practice also you have to mention giving an example. Okay, Shastra Karma, Ashtavida Shastra Karma, you have different references. In Sushruta Samhita, Sutra 25th chapter, an entire chapter is being allocated for Ashtavida Shastra Karma. But you get the definitions or the basic mentioning, first mentioning, what are those? You will get in the Agrioparanya Adhyaya itself, where Trivida Karma is being mentioned. Okay. and where and all it is indicated, that is being mentioned. And for 5 marks, only Sivana Karma can come for 5 marks. About the suturing materials used in Ayurveda and contemporary aspect, you can list out. Okay. Whenever you are writing some names or classifications or list like Akshara types, Agni Karma types, Rakta Mokshana classification, or Shalya types like Nija Shalya, Agantuja Shalya, you have to use a flow chart or table. It is purely like a mathematics. If you highlight the formula, if you write the steps properly, you will get full marks, especially for 5 marks questions. You will get out of out also. Okay, not like a 3.5, 4, you will get 5. But it's not in the case of 10 marks question. That's how evaluators' mind work. Okay, Kshara, the Pratisaraniya Kshara preparation, Mrudu Madhyama Tikshna Kshara, and what and all materials you add for Madhyama Kshara and Tikshna Kshara, you have to remember at least 2 or 3 of them. And you have Kshara as a Paniya Kshara and Pratisaraniya Kshara based on the mode of administration. So those things, indications, contraindications, you have to remember. I was saying about the mentioning of the classification. So Kshara types and Agni Karma types based on Dahana Upakarana you are using, which material you are using, you have different types. Like for the location wise purpose, Snayu Pradesha, Asti Sandhi Pradesha, Twak, where you are using Agni Karma, so which material is used. So based on that, you can write as a classification. Based on the Prakara, in what way, direction, and what pattern you are using, Bindu, Valaya, Lekha, Pratisarana. So those classification based on the pattern. Okay, so that classification you can write as a flow chart or a table, or if you are very good artistic person, or even you are not an artistic person, still roughly you can draw something matter, you can do that, especially in Bandha Vidhi and Rakta Mokshana also steps. So whenever you have a Jalokavacharana and Siravyada, they are the most favorite question for 5 marks separately asked. And Siravyadhana, you are expected to write the Samyak, Hina, Ati, and Samyak, Ati Rakta Srava Lakshana management, and Hina Rakta Srava Lakshana, and why you are again doing a pricking. And the whatever procedure you are writing, you have to stick to the Trivida Karma, Purva Karma, what is the prerequisites for Kshara, Agni Karma, or Rakta Mokshana, or you are doing some what do you say as a bandhana, what are the prerequisites, and what is the main karma you are doing, the Kshara Karma itself, or Kshara Sutra application itself, or Agni Karma itself, Rakta Mokshana, Siraveda or Jalokavacharana itself, bandhana itself, which type of bandhana, which material use, that is in the main operative or Pradhana Karma. Paschat Karma in relation to Kshara Karma, Agni Karma, Rakta Mokshana and Bandha Vidhi, you have a post procedural advices. And in Kshara Karma, immediate Paschat Karma will be the Amla Dravya usage. Okay, so that the buffering action happens. Kshara plus Amla will lead to Madhurya Bhava. Okay, so Agni Karma, immediate post Agni Karma, you have to apply at least Kumari Rasa to the location. That is a practical point. Okay, so Rakta Mokshana, you have to do taking care of the Jaloka, otherwise that will lead to a Indramada. It will get intoxicated and complicate, lead to the death of a leech. And thus taking care of the site of a Jalokavacharana and the patient. So those things has to be systematically written with the proper side headings. Highlight the important point you want to show and you know the answer. Highlight the classification, types, numbers. Okay. And Bandhana Vidhi, if you go into, you have 14 types of Bandhana, 1-4 types of Bandhana according to Sushruta, 1-5 types of Bandhana according to Vagbhata. So Utsangi Bandha, the sling bandaging. Okay, so that is being added by Vagbhata. Okay, so those names, where and all, Kosha, Dama, Muttoli, Anvilita, all those types, where exactly they are used. So based on the site and Bandhana relation to the season and dosha, they can come for 5 marks. And Bandhana classification alone can come for 5 marks. Bandhana Vidhi, the Bandhana Dravya can come for MCQ. That is Vikeshika, Pichu, Plota, Kavalika. These things can come. What are these? What is Vikeshika? What is Kavalika? What is Pichu? What is Plota? They can be coming for MCQ. Okay, fluid, electrolyte, acid-base balance and nutrition in surgical practice. So in surgical practice, you have subpoints that in pyloric stenosis and in burn cases, in intestinal obstruction, there are severe vomiting, or in dehydration cases, there is a need of total parenteral nutrition or the fluid and electrolyte advice. Even in shock, hypovolemic shock, we have fluids intake or the direct blood transfusion. So what is the importance of that? That is a very practical point. If you see the red highlighted points, they will be asked only for MCQ, but they are the more practical points. So in Viva, you may get the questions. So especially Rakta as fourth dosha, what is a supportive point, what is the against point, why it is like given importance. So those things can be a Viva question or MCQ questions. Okay, life-saving emergency medicine in surgical practice and diagnostic techniques, they can be a MCQ question, like what is a diagnostic finding or X-ray or CT or MRI finding in a specific condition, or what do you advise in a clinical scenario, what is a investigation of choice. For example, in gallstone or cholelithiasis, the ultrasound abdomen is a investigation of choice. Okay, Shatkriya Kala in surgical practice. So Shatkriya Kala in surgical practice is a very, very important question for MCQ as well as for 5 marks. Okay, the SAQ. So here Shatkriya Kala in Arshas, Shatkriya Kala in Bhagandara, you have to give an example. Or if you look into whatever shlokas you study for Shatkriya Kala, Sanchaya, Prakopa, Prasara, Sthana, Samshaya and Vyakta and Bheda, Acharya himself has given an example of Vrana Shofa turning into a Vrana and in the Bheda Avastha with the complication. So that is explained in a chapter called as Vrana Prashna Adhyaya, Sushruta Sutra 21st. See, wherever I am saying, talking about the important point, I am quoting the reference. That is also very important. If you don't remember the reference, which chapter, which shloka number, at least write Sushruta Sutrasthana. If you don't remember the number, that is also fine. Chapter number, if you remember, that is well and good, very good. If you remember the complete shloka number with the chapter number and the sthana, that is the perfect thing to remember. Okay, Shatkriya Kala, you have the Sanchaya Avastha, Vata Pitta Kapha Lakshanas, Prakopa Avastha, Vata Pitta Kapha Lakshanas, and Prasara Avastha, Vata Pitta Kapha Lakshanas, Sthana Samshaya and Vyakta and Bheda. You know, in Nidana Sevana Avastha itself, if you compare the Shatkriya Kala to the Nidana Panchaka, in Nidana itself, continuously taking the Nidana Sevana, whether it is Ahara, Vihara, whatever the Nidanas are there to the specific disease, the patient will get Sanchaya Avastha. Further intake, indulgence will go for Prakopa Avastha. Once the doshas gets traveling to in the Srotomargas or Srotasas, that stage is Prasara Avastha. And if you can call it like Prakopa and Sanchaya will happen, it's in own sthana, Swasthana. Like we have a Pakwashaya for Vata, Amashaya for Pitta, and the Urasthana for Kapha, right? So there, if Sanchaya and Prakopa happens, other than their own side, if they travel, that is Prasaravastha. And Sthana Samshaya, you get the Purvarupas, okay? And Vyaktavastha is Lakshanas. It can be a Samanya Lakshana or Vishesha Lakshana according to the doshas, okay? And Bhedavastha, we always say Upadrava. Okay, so those things has to be specifically mentioned and written. So you can see that is the allotted separately 5 marks for Shatkriya Kala. And yes, they can be asked for the 5 marks SAQ. That is a favorite question asked because that is a main gist given, contribution given by Acharya Sushruta for Vyadhi is considered. If Samanya Vyadhi Parichaya contains the explanation of Vranashofa, Vidradi, the Kotha, and you have explanation or disease discussion of the Kotha is gangrenous condition, and you have Kshudra Rogas, next Manya Vikara, Vrana. And in Samanya Vyadhi Parichaya, if you see, Vranashofa stages are very important. That is this Amavastha, Pachyamanavastha and Pakvavastha. The Lakshanas are also very important. Ama, Pachyamana and Pakvavastha. In Vrana Shobha, the Saptopakrama of Vrana can be asked. What are those? The names can be asked. Samanya Vyadhi Parichaya is a very important topic. And Vrana is one more basic thing of Shalya. If you see the Shalya definition, the last word will be Vrana Vinishchayartham cha. There, Vrana Vinishchaya, you are deciding the wound, that is surgical wound, where to put an incision, where to do the incision and excision. So that is a decision of a surgeon. So to decide the Vrana, Shastra Vaidyakrita Vrana. So the surgeon creating a wound or Vrana. So there you should know how to manage that also. So that can be Vrana. In that also you have the classification. Nija Vrana and Agantuja Vrana. Nija Vrana because of doshas. Agantuja Vrana because of the external foreign materials. You have the shlokas, specific shlokas for that. Their stages of Vrana is very, very important. Okay. The Dushta Vrana, Nija Vrana, Ruhyamana Vrana, Rudha Vrana, all those stages are very, very important. Dushta Vrana also can come for separately for SAQ. Vrana stages, Vrana, Chikitsa, and Pancha Lakshana of Vrana is also very important. Okay, so what are those? Varna, Srava, Vedana, Akriti, and the Srava. So according to dosha, you have a discharge, different discharge. These are Pancha Lakshana of Vrana. Shashti Upakrama of Vrana. So those are also very important. You can divide those into a set. Okay, so what are the Vrana Shodhana set, Vrana Ropana set? In Shobhavastha, what you do, and in Vranavastha, what you do. So Acharya have beautifully explained in that chapter itself. Okay, Kshudra Rogas are always asked for MCQs, and even in Viva they can ask. Okay, about the Kadara, the Pashana Gardhava, and this what you call as Niruddha Prakasha and Sanniruddha Guda, all those Guda Brahmsha also comes in Kshudra Roga because they are also asked in paper 2. Okay, Guda Brahmsha is compared to rectal prolapse. Sanniruddha Guda is a rectal stenosis or anal stenosis. And you have a Niruddha Prakasha, that is phimosis. Parivartika, see, Parikartika is fissure in ano. Parivartika is the paraphimosis. Okay, so those words are very tactic. So in hurry bari, don't make a mistake. And hemorrhage and hemorrhoids, there also people make mistake. Hemorrhoids is arshas, you all know. Hemorrhage is bleeding, you all know that. But during exam, don't make a mistake and write something else. Okay, read question properly. Manya Vikara, you have Galaganda, goiter. There also the Ayurvedic aspect, how Ayurvedic aspect is very important. Same way, contemporary aspect of goiter, toxic goiter, and surgical points. See, don't simply write investigation names and surgery names. You have to write few points under the surgical aspect. We'll see the next slide about that. Siradhamani Vikara is also one of the favorite question asked for large and short answer questions, where Sira Vikaras, you have varicose veins and deep vein thrombosis favorably asked. Deep vein thrombosis can come for 5 marks. Varicose vein can come for 10 marks. Along with the Siraja Granthi, you have to write. And while writing a conclusion, you can mention clinically, people treat varicose vein like a Raktagata Vata also. Okay, so Siravikara, in varicose vein answer also you have to write the stages, and there is a classification about varicose vein, that is SEEP classification, CEAP, CEAP, SEEP classification. Kindly go through that so that you will understand how beautifully, based on the classification, anatomy, and based on the pathology, how the varicose vein is being divided. Okay, so that you have to mention. Examination points, you have to write the name of an examination, what is a tourniquet test, how it is done in brief if time is there. If time is not there, write the name of the test performed and write the finding. You perform tourniquet test, how you identify the saphenofemoral junction is being incompetent or the perforators are incompetent. Incompetent means they are not doing its function. Okay, so Dhamani Vikara, you have aneurysms, atherosclerotic changes. The favorite question in Dhamani Vikara is thromboangiitis obliterans, which is known as Burgess disease. Okay, so smoker's disease it is. And the same way, Raynaud's disease and Raynaud's phenomenon in cold climates or panic attack conditions. Raynaud's disease is the person is continuously having that disease irrespective of exposure. Their arteries are compromised to form a dry gangrene changes in a upper limb. Okay, Snayu Vikara, you have 5 marks weightage, that is 2 for MCQ. There you have a diputrine contractures, tendonitis, tenosynovitis. You have a syllabus copy in detail. I am not elaborating the each point. How to write this MCQ, what to be focused. The common site of ganglion cyst, common management of ganglion cyst, Dupuytren contracture, how you identify, what is tabletop test. So whatever are the syllabus points mentioned for only MCQ, not for SAQ and LAQ, the most practical points, they are also the favorite question for Viva. Okay, and from the basic concepts like Shalya, Yantra, Shastra, and Trividha Karma, Ashtavidha Shastra Karma, Yogya Sutriya, Marma and Marma Ghata. Marmaghata or shock is also mentioned in Samanya Vyadhi Parichaya. You have hypovolemic shock, hemorrhagic shock, septic shock, neurogenic shock. They can also come for hypovolemic shock, and hemorrhagic shock especially can come for large questions or 10 marks question also. Okay. So Snayu Vikara I was talking, I just went back to the previous points. Snayu Vikaras, you have tendonitis, tenosynovitis. Those things, how you identify. Golfer's elbow, tennis elbow, what is the location? What is the medial epicondylitis? What is lateral epicondylitis? So that things, simpler things can come for MCQs. HIV, AIDS and hepatitis B and C managements. So where you are following a universal precautions for hand glousing techniques, or you have double gloves wearing techniques or PPE wearing, and what tests you have to perform prior to the surgery while you are performing a surgery on an AIDS patient or a hepatitis patient, which are vaccinable or having a vaccine. So they have to be vaccinated. The basic information you have to know. So I have not mentioned the Sanyaharana and sterilization aspect. In sterilization, the classification is very, very important. In anesthesia stages, the drugs, dose, time of induction of anesthesia is very important. You can remember the table where the name of the anesthesia, dose, by how many minutes they'll get induced. Means we have to wait that much minute minimum so that the area or the person is getting anesthetized. And requirement for the general anesthesia, stages of general anesthesia is very, very important. The one of the type of the anesthesia can come for either 5 or 10 marks. Compulsorily, one of the question will be there from anesthesia. And sterilization drugs and dosages or routes or types are, anesthesia types and routes I was talking. They can come for MCQs. Sterilization techniques, especially which instrument is sterilized in this particular way. So that can be coming for MCQ. And if you revise the previous year question papers and stick on to the syllabus, you will understand how the fundamental concepts, this is a repetition of the fundamental concepts which are commonly asked for large questions. Okay. Introduction to the Shalya Tantra, the development of surgery, Yantra Shastra, as I was saying, the Guna, Dosha, and we have Karma of Shastra, that is Ashtavidha Shastra Karma, Trividha Karma, Ayurvedic aspect as well as contemporary aspect, where the Chedana Prakaras and the what you say as NBM principle, and you have a consent and emergency consent shloka, that is in Atipateshu Rogeshu Nached Vidimam Bishak Pradiptagaram. So you have to act as quick as possible as the house is burning in the fire. You have to act that much quick. So you have to explain to the patient party or bystander that they have the whatever is treatment is given, still you have a both possibilities and take a consent. There may be a progression or a complication, so you have to take an informed consent pre-operatively. Okay, so to that point you have to write. Shastra Karma, you have elaborative indications for Chedana, Bhedana, Lekhana, Visramana, Vyadhana and Sivana, all those, Yeshana also, Aharana. So these aspects you have elaborative explanation. Yogya Sutriya alone, the entire chapter can come for a large question. Okay, you have to mention the type of surgical training, that is either Ashtavidha Shastra Karma, Kshara Karma, Agni Karma, Karna Vedhana, Bandhana, all those things are a training thing, where you are doing it and how that is being useful. So that interpretation will fetch you more mark. So for example, you are doing a lekhana. So you have a dead animal skin with the hairs. So you are doing a lekhana karma, so that the tension and pressure you have to apply. So the interpretation is the measure the or how much pressure should be applied, how much pressure should be applied for scraping or the shaving the part. So part preparation before surgery is being done by practicing lekhana karma. Okay, so scraping, how much deep you have to go, while curettage or evacuation, how much pressure you have to apply. In Prasuti Sri Roga you have DNC, so that Yogya Sutriya you can apply. So you need not stick on to only surgery means Shalya, Shalya, Shalya. You can inculcate the points of Shalakya or Prasuti wherever you are doing a interpretation of Yantra, Shastra, Kshara, Agni, Rakta, Mokshanas. Okay, Kshara you have Kshara Taila, Kshara Pichu, Kshara Sutra, Kshara Plota. Kshara Sutra preparation shloka is also very important, as Kshara Karma is considered. So that is from Chakradatta, who first mentioned the preparation of Kshara Sutra. Bhavitam Rajani Churnaihi Snuhi Kshirasya Punaha Punaha. Bhavitam Rajani Churnaihi. So Bhavana of Rajani Churna means Haridra. Okay. Snuhi Kshirasya Punaha Punaha. Snuhi Kshira, Sudha Kshira is from a latex of a plant. Okay, that is a cactus origin plant. So that will be taken and it is applied. So you have to take a linen thread, linen or linen thread, which is named as so barber's thread, number 20. Okay, you have to coat. How much you have to coat? 11 plus 7 plus 3. So that is 21 coatings. Same number is there when you are preparing Shara. How many times you have to filter the bhasma after adding water? 21 times. Okay, so that number is beautifully fitting to Kshara. 21 coatings, 11 coatings of what? The Sudha Kshira of 11 coatings of Snuhi Kshira. Okay, and 7 coatings of Snuhi Kshira plus Haridra, and 3 coatings of Snuhi Kshira plus Kshara. Okay, which Kshara you have prepared, so that can be applied. And each time whenever you are applying the linen 20 with the Kshara or Snuhi or whichever coating is there, each time you have to dry under UV light sterilized chamber. Okay, Kshara Sutra cabinet, you have to dry it. Okay, so that is, you have a detailed explanation for that in your books. Samanya Vyadhi Parichaya, I was saying Varnashofa stages are important. Vidhradi, Antarvidhradi sites, 10 sites of Antarvidhradi are very important. Dagda Vrana, burn stages are important, depth of a burn. And you have a rule of 9 for burn, scald, and the Dhumopahata Lakshanas. Those are important. Shock, Marmagata, you have Marmagata Samanya Lakshana, that is also very important. Dry gangrene and wet gangrene difference can be asked. Granthi, Medoja Granthi, lipoma alone can come. Sebaceous cyst, what is the content? That can be asked. And there are cysts and swellings which are like Siraja Granthi, which we are correlating to varicose vein. That may cover 2 points. So that can be a favorite question. Okay, Arbuda, we have difference between benign and malignant tumors as a question. Dvirarbuda and Adhyarbuda, what is that? That can be a MCQ question also. Okay, so commonly the Samanya Vyadhi Parichaya is a large answer questions syllabus is there. So you can expect from the topic of shock, Vidhradi or Vranashopha or this burn and scars. Okay, so that's a favorite part from this point. Vrana, we know that is a vast topic of wounds and ulcers. According to Ayurveda and contemporary aspect, they are important both practically as well as for the exam purpose. Siradhamani Vikara I have already mentioned. So moving on to the next. Is it visible and I am audible?
Yeah, it's audible.
Yes, slides are visible, right, sir?
Yeah, visible.
Okay, sir. Thank you, sir. So presentation skills. So if you are moving to the presenting the paper, okay, so paper 1 or paper 2, Shalya is mainly, as I was saying, it is more of technical point. So you have no grammatical issue here. Don't write paragraphs together unless there is only the explanation to be written in paragraph. Like even the meaning of a shloka can be written as a flowchart or table or like a diagrammatic representation if possible. Okay, so I am just mentioning shloka meaning can be crisp and precise, and whenever you are writing a classification you can write as a table chart, or if you are writing a paragraph, don't or never miss to underline the words which are important or to be highlighted. Okay, so there are pattern you can write like an introduction which can include a major point like a location or a major reference points like Ayurvedic aspect like Shatkriya Kala. You are writing that this is a Kriya Kala is Chikitsa Avasaraha. Kriya Kala is Chikitsa Avasaraha, where you have the importance to stop the pathogenesis, or you are have to act, or you have to treat. Okay, so this reference is from Vrana Prashna Adhyaya, Sushruta Sutra, 21st chapter. So first, if you write the reference, each shloka or each explanation, whatever you are writing, it is understood, it is taken from the above references. So each time if you forget to write the reference also, that will be written in the top, and highlight the points whichever is important to that aspect. Like sterilization topic, if you take, you have to highlight what is actually sterilization is. So the definition you have to mention as it is. Okay, so that highlight points is very important. And if you take, as I was saying, the varicose vein. Okay, varicose vein introduction is varicose vein can happen anywhere in the body. Okay, so that is not only in lower limbs. Lower limb varicose veins we are normally considering as varicose vein. Varicose vein of a esophageal vein, esophageal varices. Varicose vein of a rectal veins, hemorrhoids. Varicose vein of a pampiniform plexus of a scrotum, that is scrotal plexus, venous plexus, varicocele. And varicose vein of a lower limbs, we commonly clinically name it as a general term varicose vein. And Ayurvedic correlation, Siraja Granthi. So explain the points, highlight the points, and introduction will be very beautifully written. And definition, if specific definitions are there, like Vrana definition, or you have a definition of this Shatkriya Kala aspect, Shara definition, Agni Karma, and those things like Sharanat Vaksharaha, Jaloka definition, Jalamasa Ayuriti Jalokaha, Jalamasam Oka iti Jalokaha. So those definitions are to be next, that to be highlighted. You can put a box and highlight, or you can underline it. Okay, and write the importance. So you have some benefits, clinical significance, importance, like bandhana importance, how that can protect the wound, how it can heal the wound, how it can stabilize the fractures and dislocations, asti sandhi. So those shlokas are very, very important. And that importance, like importance of Agni Karma, Ksharad Agnigariyat, that shloka, and importance of Kshara Karma. So how it is Shastranu Shastrebhya Kshara Pradhanatamaha, that shloka you can write is a importance. Classifications you have based on Dravya, based on site, based on that. So basis of classification, you can put a flow chart and write down one below another and explain each of them if the space and time is permitted. And the marks, see the marks. If it is asked for 10 marks, you have to explain each. If it is asked for 5 marks, include other points related to that, like signs and symptoms related to Vrana, Shofa, Siradhamani Vikaras, or Manya Vikara. So those Vikaras or diseases, if they asked, signs and symptoms are must. Okay, the highlight catchy points like in varicose veins, I am saying repeatedly, because there you have a stages, typical signs and symptoms, the visible blowouts, tortuous veins. So those things are very important to highlight. And dermatitis, eczema features, in which stage. So those things can be written. Management or aspect, if you consider, you have to divide that into a medical management, surgical management, and dietary advices. Okay, patya. Okay, so in Vrana chapter, you have Vranitopasaniya Adhyaya and Hitahiti Adhyaya, 2 chapters for completely Vrana Patya advices of do and don'ts. So it's not just like avoid Vatakara Ahara Viharas or indulge in Ushna Shita Laghu Aharas. Don't always bluff like that. See which is particularly told to that particular disease. And additionally, you can write those things. Okay, so you have to highlight those special points. As I was saying, classification, underline the word and write table and chart. Signs and symptoms, you have to mention the triad signs and special features. Like in case of Vrana Shobha, you have Pachyamana Avastha, there will be Nistudyate, Daha, Raga, Shobha, all those things. So it is like a full-fledged abscess, or it contains the high inflammatory stage. So that typical features should be highlighted. And wound healing stages, if you take, they're also highlighting of which stage, which feature is there. Burn, as I was saying, 1st degree burn, 2nd degree burn, 3rd degree burn, how much thickness that is being burned. Dehydration stages and what stage, what features are there. So the signs and symptoms are according to the stages, then that has to be written in the same way. If general signs and symptoms are there, as Ayurveda is considered Samanya Lakshana, Vishesha Lakshana, you have to write in the same way. But never write like a paragraph and barely write it. Each heading, a side heading is very important. Highlighting is very important. Okay. And Hina Ati Samyak Lakshanas for Kshara Dagdas and Agni Karma Dagda is important. And Hina Ati Samyak of Siravyadana and Jalokavacharana. And how you manage the Hina Lakshana, Ati Lakshana. And if Samyak Lakshana has occurred, what is the post procedural things to do? So that Paschat Karma to do. So as Kshara is applied, you have to wash it with the Nimbus Rasa or Amla Rasa Dravyas. Okay. Agni Karma, you have to apply Kumari Rasa or the Shita Dravyas. Okay. Agni Dagda, you have Pramada Dagda Lakshana. That Pramada Dagda word or Pramada Dagda alone can come for 5 marks. So what does it include? You have to check in. Okay. So Durdagda and Atidagda, both are combinedly called as Pramada Dagda. Okay. Durdagda and Atidagda. So you have to focus on important points like classifications. If they consider, they alone can come for 5 marks. Okay. Shalya types, Shalya Gati, they cannot become coming for 5 marks. Shalya types and Shalya Gati of Panchagati of Shalya, that is there in Pranashta Shalya Adhyaya. Okay, you can read back that, and you have MCQ possibility in that area. Yantra Prakara and Shastra Prakara is a 5 marks question. So which Shastra and Yantras are used for which karmas? So that is very important, especially if you consider Shastra. So we learn Yantra Prakara, Swastika, Sandamsha, Nadi, Tala, all those Anuyantra, we learn that. And what is a property and where it is used, we learn. But Shastras, you have to learn the names and set of the Shastras for Chedana, set of Shastras for Lekhana. That classification and interpretation is very important to write. You can write the same if Shastra question comes, the same can be written if Ashtavida Shastra Karma question comes. Okay. So sterilization classification alone can come for 5 marks. Anesthesia types, the flow charts you have to remember. Anesthesia types are also very important. Among that, individual anesthesia variety can come for 5 marks or 10 marks. Okay. How much detail you have to write? If anesthesia types come, type of anesthesia, like a single type, if spinal anesthesia comes or local anesthesia comes, they do have a subtypes. Okay, so you know local anesthesia have infiltration anesthesia, nerve block, and sprays and foams or ointments. That is a surface anesthetic. So all those varieties you have to mention and how exactly it is acting. One line or two line explanation is enough. And drugs used, anesthetic drugs used, that I was saying, name of the drug, dose, and induction time, by how many minutes the anesthesia effect will be induced, that you have to write down like a briefing or table, not in a paragraphs. Okay, never. That will be evaluator will be thinking you are just writing explanation, means you did not study deeply. Okay, Vrana classification is very important as doshas or nija. Vrana classification and the combination of doshas. So those are very, very important. Each Vrana type lakshanas you cannot remember and write in the exam, and time is very limited. So each, like Vataja Vrana, Pittaja Vrana, those things are very difficult, but you can remember the Pancha Lakshanas of Vrana. Okay, so Varna, the discoloration according to Vata, Pitta, Kapha, Gandha, and Srava according to Vata, Pitta, Kapha. So Vrana, Srava, Adhyaya, you will get all these Panchalakshana of Vrana explanations. Vrana Vedana, like Vataja, will be having more dominance of pricking pain or twisting pain, all those things. Daha, Raga, all those things will be Osha, Chosha, Paridaha will be there for Pittaja. Kafaja, you have Kandu and Gauravata. So those body as if is covered with the wet cloth kind of feeling. So that will be there in Kafaja. Akriti of that of Vrana. Shape, edges, margins. So all those things will come under Akriti. Okay, so the Prakrita Akriti and Vikrita Akriti. Prakrita and Vikrita, Varna, Gandha, Srava, Vedana. You have to remember few of them at least. You can write. Okay, so because Vrana classification lakshanas, each of them you cannot remember. You have to remember the stages of Vrana. Okay, so Kshara types, prakaras, I have already mentioned these things. Classifications are very important. You have to write like a flow chart. Okay, so I have given one example of Vrana flow chart, a general classification on the basis of avastha stages. Dushta Vrana, Shuddha Vrana, Ruhyamana Vrana, and Rudha Vrana. These are very, very, very important. Only stages can come for 5 marks. Each shlokas you have to write, meanings you have to write. Okay, you have to interpret how much it is important. Okay, so how much it is important? You have to treat Dushta Vrana, Shodhana, Ropana, and the protocols should be followed. And then you get Shuddha Vrana. Shuddha Vrana it is devoid of Puya, Puti Puya, and Ati Dushta Rakta. And you don't have a doshak involvement. And then it starts healing. So once it is Shuddha, Shodhana is done, you start the Ropana karmas, then it will be ongoing healing, Ruhyamana. Once it is healed completely, it is Rudha Vrana. Okay, so that's why in which stage, which treatment, among which Shashti Upakrama you have to select. So that depends on the avastha. Okay, surgical steps, draw labeled diagrams if possible, and picture with the caption is very important. So whenever you are writing surgery, these points are very important. Position of a patient, type of incision, anesthesia used. Never miss this. Okay, if you don't remember which type of anesthesia used, see the disease and see whether the patient may feel severe pain or not. Think that you can't bluntly or vaguely write it. General anesthesia commonly used in elderly people and children, those who cannot control their movements. So you have to seduce them or generally anesthetize them. And in local surgeries, you can use local anesthesia. Below umbilicus, any surgeries are there, you can choose for spinal anesthesia. You have indications of each anesthesia. So go through that. And whenever surgery you are writing steps, you have to mention these. Okay. Steps in brief, you have to write if it is for 5 marks. Directly surgeries will be asked in second paper, not in first paper. And focus on surgical anatomy whenever you are writing. So sir will deal with that in the last sessions about second paper when they are taking orientation. Okay, so whenever there is a triangles or landmarks like in hernia surgeries, epigastric vessels are important landmarks. In cholecystectomy, you have Calote's triangle. So those things are very, very important to mention. Okay, so in abdominal surgeries, the first point after writing a position, incision type, anesthesia, first step will be abdominal layers are opened layerly, or at the last step will be abdominal layers are closed in layers. So that's, you need not write skin, superficial fascia, deep fascia, muscular layer, and peritoneum, or organ is identified. So those things, steps, you need not write. So that's why I said steps in brief. So these two words will help in abdominal surgery, so that those details will be dealt by sir in the last sessions. These are just examples how you presentation skills, like a flow chart, table, highlight, and rough diagrams. I have given a rough diagram of IND, incision and drainage. So you have to paint and drape. The abscess area only should be visible. Incision site you have to mention, and you have to materials, gauzes, and all those things you have to require. And local anesthesia is enough for incision and drainage. Stab incision, or you can go for a T incision. Okay, so that is named as a horizontal or vertical incisions you can give, or you can have to open up with the blunt artery or artery forceps, opening the cavity, and then not directly packing. The next step, you can write the explanation, like opening the cavity, take out all the pus, drain all the pus, and check the locules with the gloved finger or sinus forceps. You have to break if any collection is there inside further. That has to be broken and content has to be removed. Then you have to pack and again take it out. If there is a possibility of recollection, place the drain. Okay, and if there is suturing is needed, you have to put the stitches, and advise follow up after 5 days or 7 days according to the site where you have done removal. Okay, so that is very important. I just given the diagrams so that how you are presenting that matters. Okay, so techniques for smart study, you have to stick on to the syllabus. How much ever I explain in 1 hour, 1.5 hours, I can't explain the entire 100-mark syllabus. You have to stick on to the syllabus while you are making notes, while you are reading. And time management is very important while studying also. You have to make a timetable. Never skip your food, never skip your sleep. Okay, so ahara and nidra is very important, and as a Ayurvedic students, doctors, you should know that. Okay, especially during high oxygen and nutrition consumption time, this exam hours. So never skip food and never skip sleep. Okay, so people are having a habit of doing night outs and studying, and if you do that, at least make the Divaswapna rule. Okay, how much hour you skip the night sleep, you have to compensate with the at least half or 1/4 of that hours has to be slept. Okay, learn how much important the topic is for the exam. That's what is. Don't waste the time in reading Rakta as fourth dosha or Naidanika Vyadi for complete explanations. So whether they are asked for MCQs, then you have to pick up from this portion how much MCQs or how the MCQs will be asked. So you have many NCSM syllabus oriented textbooks which are having examples of MCQs from each chapter or few of the chapters. So you can read out that also. Okay, so LAQ questions having syllabus, you have to first finish it, double read it and revise it. Okay, so they can be asked for either 10 marks, 5 marks or MCQ. Prepare short notes, key points and quotes to remember, and you have to revise. So once one reading is not enough. Okay, write down and repeat what you have read. So writing means you are 2 times reading or 3 times reading, because you will be seeing, you will be remembering it orally, and you will be writing. Okay, so that is 2 or 3 times reading. There is no shortcut for knowledge or to reach your goal. If you are aiming for distinction or even passing, you have to study, but you have to stick on to the syllabus. Okay, so that's about how exactly the things are. So as I was saying, you have to stick on to the syllabus. See the marks distribution, the 15 marks for point 1 to 7. So 15 marks for parasurgical alone. Okay, Kshara, Agni and Rakta Mokshana. And 10 marks each for Vrana and Samanya Vyadhi Parichaya. And 10 marks for Siradhamani Vikaras. So they are the portion where LAQ is possible. 10 marks question is possible. Even MCQ and SAQ is possible. Okay. Other points where you feel they are the very important topics like Marma and Marma Ghata is there in Samanya Vyadhi Parichaya. So they can be asked for 5 marks, or this Marma classification you have. So many types of Marma based on components, based on Parinama, Pramana. All those things are important for MCQ, not for 5 marks or LAQ. Okay. For knowledge purpose, for practice purpose, Marma therapy purpose, it is important, very important, but not for exam as for now. Okay. Marma Ghata is very important. 5 marks or 10 marks, it can come. Shock, it can come. Okay. So as per Bandhana Vidhi and Pranashta Shalya is considered, 5 marks question, classification of Bandhana and Bandha Vidhi procedure can come. MCQ, as I said, Bandhana Dravyas can come. Pranashta Shalya Aharana Upayas. 15 methods are very, 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 very important. You have to remember, read that. They are very important for 5 marks. Okay. Shatkriya Kala can come for 5 marks. The marks weightage is 5. Okay. So Kshudra Roga is for MCQ. Manya Vikara, 5 marks. Goiter can come. Galaganda is a favorite question for 5 marks. Okay. Snayu Vikara for MCQs, you have to revise at the end at least. Okay. Whatever is there for only MCQ, revise at the end. Okay. Whatever is there important, finish it double reading as early as possible. Okay. So thank you. If any queries is there, according to the syllabus point is considered, I can open the PDF.
Thank you, madam, giving a brief and crispy guide view on examination points. And here the time for students, if you have any doubt in Shalya Part 1 paper, please you can ask your queries. Or if you have any doubt in old question papers, you can ask in the words which you doesn't know when you are revising the questions. There are some words will be new to you that you can ask.
Yes.
It is compulsory to write shlokas or else Sanskrit terms.
Yeah, shlokas, if you write in Sanskrit terms, that is very good. If you don't remember the shlokas, then you can use Sanskrit words in the answer. Sanskrit words in English spelling, you may get the marks, but not as expected.
Any questions? Yeah. We are facing difficulty in remembering names of Shastra, ma'am.
Yes, names of Shastra, you have 2 pairing Shastras. So you can remember like for Chedana Yogya Shastra, Bhedana Yogya Shastras, or Lekhana Yogya Shastra. So Chedana, Bhedana 1 set, Chedana, Lekhana 1 set. That's the how that is being categorized. In a name of a Shastra, next 2 shlokas, if you see in the Sushruta Samhita directly, you will get those. And you can write in that way also. If Shastras are directly asked, you can write in that classification way also. So you will remember that easily. And if you read 24, those names can be paired as a 2-2 pair. Okay, 2-2 names pair. So you can remember that. Mandalagra, Karaputra, like that. Okay.
Can I ask this question, madam?
Yes, yes.
If Vrana comes, then it is compulsory to write ulcers and wound also.
Yes, that's when Vrana comes, they will be specifically asking the question. Okay, define Vrana stages, all those things, and see the marks weightage. Okay, if it is for 5 marks, you have enough matter for 5 marks in Ayurveda itself. And in the conclusion, you can write the definition of wound and definition of ulcer and just management names. Okay, that is enough. If you have time, then only write. If you have space, then only write, because Ayurveda have enough explanation for 5 marks and even for 10 marks. But for 10 marks, mentioning a ulcer and wound is very important. Okay, at least you can draw the diagram, and ulcer, parts of ulcer, that can be at least mentioned, and management like wound healing stages, names, and management of a wound or management of ulcer names. If you can write, that is well and good.
Next question.
Yeah.
In LAQ, if Arbuda is asked, we should write modern.
LAQ Arbuda will not come. LAQ, only SAQ may come, but LAQ Arbuda is not asked, because earlier, as per the previous CCM syllabus, they were asking, but NCSM syllabus, MCQs, they will be asking frequently. SAQ, it may come, but you can briefly write. So you have different terminologies. So those things you can remember and you can write. Okay, what you can do in benign, what you can do in malignant. At least remember whatever condition, disease conditions are asked, remember the general method of management. Okay, so for example, if Arbuda is taken, you have the stage like Dvira Arbuda and Adya Arbuda, and you have modern aspect. If you take benign and malignant, what is the key difference? So when there is a metastasis is present or not present, or how it is localized or generalized, how the spreading or differentiation happens, proliferation, how quickly it happens, how limited it is, how it is not. The key differences you have to write brief out. Management, you have a general management of chemotherapy, radiotherapy, and surgical excision. Okay, those three words at least if you write, they may consider. If you not remember full thing, or if you cannot write full things, general management things you have to write, so that you will get at least, if 5 marks is not there, 2.5 at least you get, or 3 marks you get. Okay, so that will add up for your passing marks or your first class marks or distinction. Okay.
Galaganda, then it's compulsory to write goiter. The same students asked the Jaloka Beda and Lakshanas. What about Jaloka Beda and Lakshanas? Two questions.
Jaloka.
One is goiter. If you go in
Yeah,
Galaganda came, you have to write the
understood.
goiter.
Yeah, understood that question. Second question is?
What about Jaloka Beda and their Lakshanas?
Yes, Jaloka Bheda and Lakshanas, I think once they have asked directly, the Savisha and Nirvisha Jaloka, six types, each type. You have to remember the names. Lakshanas, you need not write the shloka. At least if you remember the words, you can write the English explanation also. But 12 names of Jaloka you have to remember. What are the Savisha Jalokas? What are the Nirvisha Jalokas? 6 each. So those you have to remember. But separately, they may not ask. Once I think it was asked for 5 marks. For 10 marks, they will not ask. Galaganda, goiter, if you consider, Galaganda also have enough explanation for 5 marks. But goiter explanation is compulsory. At least briefing you have to write in the end. If Galaganda in bracket goiter is mentioned, it is must to be written even for 5 marks. But don't write complete surgery of thyroidectomy, all those things. You can write hypothyroidism or hyperthyroidism, both condition goiter can occur, and what are the key features of goiter, how the iodine deficiency is influenced, and what are the other conditions which cause goiter. So those things you have to write key features. Okay, so that toxic goiter features like exophthalmos, all those things should be written and highlighted. Okay, how you manage also, it's very important. Surgical management is very important. So thyroidectomy has, surgery has a classification. So if you remember that partial thyroidectomy or complete total thyroidectomy, so pan-thyroidectomy means you are including the lymph nodes also. Okay, total thyroidectomy, only thyroid is removed. Or partial thyroidectomy, one of the lobe is removed with the isthmus or without isthmus. Okay, the key point as the question is considered, Galaganda Ayurvedic explanation do have 5 marks content. If time permits, conclusion aspect, you have to write the contemporary aspect, or you may lose 1 or 1.5 marks.
We should need to study Shashti Purukama in detail, and we should compulsory to write in order only.
Yeah, orderly writing, if possible, it is okay, but they were not asked Shashti Upakrama for 10 marks separately. because Vrana has other aspects to remember, and they have asked like what you say, set. Okay, so Vrana Shodhana procedures or Vrana Ropana procedure or any one of the procedure, what exactly is done as a MCQ. They have asked all the 60, if possible, try to remember, but in exam for large question, they have not asked Shashti Upakrama separately. Okay, so set twice you can remember. For 10 marks, when you are writing Vrana management, for 10 marks, if they come, or 5 marks, you can write as a set. Okay, so for they are mainly divided into 2 sets. Okay, Shopha Pratikriya and Vrana Pratikriya. So under Shopha Pratikriya, what are the modalities? Under Vrana Pratikriya, from which to till which. So in between, you can write like a from to. Okay, how we classify Saptopakrama. Same Shashti Upakrama is divided as Saptopakrama. So that can be classified. Okay, so those classification will help. Shashti Upakrama is divided into Saptopakrama. So that can be written as a under Vrana Chikitsa also you can write.
Okay, I think questions are over. And thank you so much, madam. Because even though you're having a very busy schedule, you have given a precious time for us and for our students. Thank you so much for behalf of students in Ayurreshmi. And students, tomorrow we are having Shalya paper 2 with Shobhita madam at 6:30 to 7:30. I asked you to join before 5 minutes before. Thank you so much. Thank you, madam.
Thank you, sir. Thank you for inviting me for this sessions, and thank you, students, for patient listening. If you have any doubt, I have displayed my email ID also. You can keep in touch with that. And I have an YouTube channel, and you can directly contact sir also. Any queries later, you can ask with him, and he will ask directly to me, and I'll answer. That also fine. And I have a email ID DRAMRUTHAGOWRI@gmail.com. You can text back in that. You can mail me any queries. I'll respond with that. Okay, so thank you. Thank you for patient listening. All the best to all of you for all the subjects. Okay, so all the papers, attempt all the questions. All the best. Thank you.
Thank you, madam. Good night.
Thank you.
Bye.